Good morning, good afternoon, hello to you all. My name is Riitta Dlodlo and I am Senior Advisor with the International Union Against Tuberculosis and Lung Disease, the Union. I have the privilege to serve as Course Director for Union International Course in TB. Since several decades, the Union has contributed to global capacity building in TB and lung health by offering international courses in various languages, mainly in English, French, and Spanish. The predecessors of this particular union's a flagship course in English include the International TB course that used to be offered in Addis Ababa, Ethiopia, for periods of 3 weeks, followed by the next course venue that was situated in Arusha, Tanzania. In 2016, it was decided to condense the contents and offer a shorter 8-day course in Zimbabwe. This is how principles of TB care and prevention, translating knowledge to action, came about. Is your national TB program struggling to end TB in your country? Are you or is your NTP concerned about unsatisfactory TB treatment coverage? Are you looking for ways to find missing, so-called missing people with TB, including missing children with TB? Are you unhappy about TB treatment outcomes in your setting and want to improve person-centered care among both people with drug-susceptible and drug-resistant TB disease? Do you want to become a better TB manager or a better TB coordinator? Do you want to meet other professionals working in TB and hear about their experiences and lessons learned and exchange ideas how to set priorities for TB services? If yes, then this course is for you. Some past participants have described this course as an eye-opener. We aim to change your mindset about TB care and prevention in this course by providing you with knowledge and skills to improve management of persons with TB disease and TB infection, as well as to strengthen the programmatic practices. Our course is a hybrid course. What does this mean? It means that the course has two components. There's an online component and an in-person component. Participants need to complete the online video lectures and read selected references in their own time before attending the in-person 5.5-day part that will take place in my hometown in Bulawayo, Zimbabwe. During the in-person component, we are planning to review key principles in TB care and prevention and discuss so-called hot topics and controversies that we face when making normative guidance operational in our programs and in the field. We are also planning to interact with the representatives of the National TB Program in Zimbabwe, and you will have an opportunity to familiarize yourself with TB services in our country. There will be 2 days of field practicals when you will practice how to analyze and use TB data for strengthening both clinical and programmatic management of TB. In this way, we will ensure that you become familiar with the approach called TB Data for Action that promotes local use of routinely available TB data so that it's used and analyzed as fully as possible. This approach has been called the Next Dots strategy. And lastly, we are planning to provide you with ample opportunities to have south to south and south to north sharing between all the participants and the local and external facilitators. The target audience of our principals course includes staff and officers of national TB programs, such as program directors and managers, and TB coordinators working at the national and subnational levels of health services. It's also most suitable for officers in national HIV/AIDS programs and non-communicable diseases programs. We would also like to gather medical, clinical and nursing officers, monitoring and evaluation officers, laboratory and radiology staff, and professionals working in health services management and anyone who is interested in TB care and prevention. Technical partners and persons who plan a career in TB and communicable diseases, perhaps in low and middle income settings with high TB burden, are also most welcome and will benefit from this course and most likely find it relevant.